Okay, everyone, welcome to a BLD guide to shoulder pain, part 1. This is going to be start of like a 4-part series where the first 2 parts are going to be over shoulder pain and the second 2 parts are going to be all about dealing with knee pain. When I put this in the group chat, like I said, I really wanted to give you an idea of exactly what I do with patients who come in or clients who come in with shoulder pain. So I'm going to go over essentially step by step how I think about it, how I detail them, how I assess them, and then how I work within their ranges of flexion available. You'll get loads of different cases of shoulder pain. There's tons and tons of injuries. I try to keep this more generic to when they come in, they have a little bit of a sore shoulder. How would we rehab them back to moving properly? And you'll see me talk a lot about gaining more range of motion. And I really mean that in relative terms. I really mean that want to gain range of motion that's available to them. So don't think that I'm looking for excess range of motion in anything. I actually think that's probably a bad thing. So just to keep that in mind as we go through it. So up first, then I'm just going to take you through an overview of everything we're going to talk about today. The first thing up is going to be an infrasternal angles and having a look at how they work. You'll see that the first couple of slides of this are quite similar to the presentation I did about 4 months ago on a biomechanical approach to everyday humans. Once again, it'd be a nice little refresher for anyone who saw that presentation. For anyone who hasn't seen that presentation, the reason I always start off with this is I want to get you an understanding of how I see the upper body before I actually start working on it. Okay, so going through narrow and wide infrasternal angles, we're going to look at a slide on understanding the thorax and how it works. We're going to talk about anterior to posterior compression. We're going to look at thoracic rotation. We're then going to look at lateral compressors per angle of shoulder flexion. We're going to look at shoulder flexion assessment, the kind of particular assessment that I like to do. Then we're going to look at exercises that have less than 90 degrees of shoulder flexion, around that line of 90 degrees of shoulder flexion, and then more than 90 degrees of shoulder flexion. So up first, we'll talk about infrasternal angles, and anyone who has ever heard me talk before knows I talk a lot about this. We can kind of break them down into 2 groups, our narrow infrasternal angle and our wide infrasternal angle. So this does a few things. First of all, it tells me what they're going to have available to them, what they might be missing, and then I can kind of rank them in 3 tiers of compensations. And this is work that I have kind of learned over the years from people like Zach Couples, Alex Effer, and mentorships that I've taken, that each infrasternal angle has particular things that are available to it, and if they are missing those, then you can rank it into a tier of compensation and work back from there. Okay, so let's start by talking about different compensation patterns and how we might use a narrow versus a wide infrasternal angle to start to determine what they're missing. What you'll hear, if you've been in a group chat for a while, part of the network, you'll hear me talk a lot about infrasternal angles and the narrow versus wide approach. Kind of the way I like to look at it is you can have a look at their infrasternal angle and kind of see what they should naturally have available to them. When you kind of figure that out, you can start to make a tier of compensation. So how far have they regressed from what they should be naturally be able to do based on their infrasternal angle? A lot of this knowledge or like information is stuff that I've gained over the years of doing internships with people like Alex Effer, Zach Couples, Alex St. Pierre, Dr. Wishloff, stuff like that. And I really recommend anyone in this network to go follow their pages and learn from them as well. But also this is something that I've just anecdotally seen for the last 10 to 15 years in the business of training people with injuries. When we are looking at it, let's say we start by looking at our narrow infrasternal angle. We can tier it into 1, 2, and 3 tiers, with the first tier being if they still have their external rotation bias. So all narrows will have more of an external rotation bias. So think more about people who have their feet turned out and stuff like that, or their hips very open. So if that's what they have and they're only missing internal rotation, that's great. That's quite an easy fix. We can start with working on internal rotation, and we'll get them moving to the higher level of capacity pretty quickly. If they've gone into that like second tier of compensation, they're actually going to merge like into each other, the narrow and wide. They're going to lose both like ER and IR. They still will be more biased to counter nutation, and they will still have better external rotation. So they'll still have a better squat and refer to like someone who might be better at hinging. And then the third tier, which is the most difficult tier to refer back to, is your rectus abdominis compensation. So the rectus abdominis muscle that comes down here, if that's overcompensating, that is pulling everything forward. So they might even lose their ability to squat well during this as well. So that's the very bottom tier that we don't really want to have to start from, but sometimes we will. And then in relation to the wide infrasternal angle, they're obviously going to have an internal rotation bias. So if they have their internal rotation bias and are just missing a bit of external rotation, great, they're in tier 1. We should be able to get them back to, once again, a good level of movement capacity pretty quickly. In their tier 2, so if they're a little bit regressed from that, once again, it's going to merge in together. So they're going to lose both ER and IR, but they still have a different diaphragm, right? So they still have a different diaphragm and still have a different axial skeleton based on the infrasternal angle. So they should still be more biased to nutation of the hips and stuff like that. And also they should still have better internal rotation. Therefore, they should have a better hinge. If they fall once again into that tier 3, which is more of a rectus abdominis strategy or compensation again, then they might start to lose their ability to hinge also. Once again, that's the furthest back we are, and we don't love to start there, but sometimes we have to. Okay, so then moving on then, let's understand the thorax a little bit better. So basically the whole rib cage attached to the clavicles and stuff like that, okay? So anyone who's from North America will be kind of familiar with some of these terms. Anyone who's from Europe, you might be, you might not be. So I'm just going to go through them. The first thing we're going to look at is the sternum. So this part here. You'll hear it called the pump handle a lot when you're in North America, and it lifts up when I breathe in, okay? All of your pec muscles are attached to your sternum. So if they are very tight and tense, then the sternum's going to be pulling them down a little bit. A really good way to think about this is if you have good eccentrically lengthened pec muscles, the more distance between your shoulder, so your shoulder here and your sternum, the better internal rotation you're going to have. So if you know someone's got a really short rounded shoulder, unlikely that they're going to have a lot of internal rotation. So we'll go through that, especially in part 2 of the presentation when we look at anterior opening and posterior opening. But it's important to remember the more distance between your shoulder and your sternum, the better internal rotation you should have. Therefore, we want good eccentrically lengthened pecs, okay? Then we have the manubrium, which is really heavily associated with breathing, okay? So it attaches to your sternoclavicular joint. If this doesn't work well and doesn't move effectively, what you'll see is people will start to shrug when they breathe a lot more through their AC joint. So you can say that someone who's like doing a lot of rows or pressing and you're seeing a lot of shrugging, especially when they get a bit more fatigued, we can probably start to see that their manubrium probably isn't working as well as we'd like it to. So once again, it's very much heavily associated with breathing. It's attached to our sternoclavicular joint. If this doesn't work very well, when they are getting a bit fatigued, you'll see them shrugging, especially in upper body exercises. So this might be one of those we talk a lot about in the network of these compounding causes. So if someone's manubrium isn't working very well, if they're not breathing very well, then their day-to-day activities, when they get fatigued, they might shrug through their shoulders, develop a little bit of tension around the traps and neck, and that might be the issue. Then finally, we have our ISA, which we just went into a bit of detail. You'll hear this called bucket handle. So when I breathe in, my bucket handle opens up. When I breathe out, it closes back in, okay? So more narrow are more closed, more wide are more open, okay? So if I'm looking to open up my more narrowed, people, then I might have an inhalation bias because when I breathe in, my bucket handle opens up. If I'm looking to improve some of my wide angled infrasternal angled people's breathing, then I might look at more exhalation work because as I come back in, it closes as I breathe out. Okay, so let me go through that again. So bucket handle, when I breathe in, my bucket handle opens up and it closes back down when I breathe out. So the more narrow, it's more closed, obviously. The more narrow is more closed, more open, more wide. So if I'm looking to improve through some maybe breathing mechanics work, one of my narrows, then I'm going to work a lot on inhalation biased. If I want to work on my wides, I'm going to work on exhalation biased. Does that make sense? I hope it does. Okay, so up next then we have our anterior to posterior compressors. Now you'll hear a lot of especially with the lower body, and when we get into the knee, we'll talk about it a little bit more, but you'll hear a lot about anterior to posterior compressors and lateral compressors. 90% of people I see with upper body issues are anterior to posterior compressed, so back to front. So what I want to break it down very simply of, if we have anterior to posterior compression of the muscles, we want to think of maybe inhibiting them during exercise or the eccentric lengthening of them. So think back to maybe your pecs, okay? So when we are someone who's extremely anterior to posteriorly compressed, we want to think of inhibiting the muscles that are compressed, that are like at that superficial tension, or eccentrically lengthening them. So up first, we have that rectus abdominis that we've talked about. That's a real anterior to posterior compressor. So this muscle here pulls us down, gives us all of that posterior tilting. When we get that posterior tilting, we lose a lot of range of motion in places. Secondly, then, we have our pec muscles that we talked about earlier. So if they are very compressed, then we lead to anterior. Obviously, if they're compressed, they'll lead to anterior compression of our chest, bringing us inwards. And then that will, as we know from this distance between our sternum and our shoulder, if we have a chest that's pulled in, then we're going to lose some internal rotation. So pec muscles, rectus abdominis, more of the internal rotation issues. And then we have like our trats, so levator scapula, our rhomboids. They compress us posteriorly, and then we lose external rotation. So think about, when you think about anterior to posterior compression, really think about that you need to move into space that's available for you, okay? So if somewhere is compressed and runs out of room for us, then obviously it's going to be harder for us to move into them. Okay, so this is one of the, I wouldn't call it complicated, but it's one of these things where people get caught up on it a little bit, and people get caught up in explaining it a little bit. So if I do, I'm sorry. But thoracic rotation is so important. The ability to rotate your upper body and lower body, you'll see it, like, you know, anywhere you have a lack of rotation is going to be an issue for most of the time with people in pain. In order to allow for movement, we need alternating compression and expansion, right? So we just talked about, like, you know, inhibiting or eccentrically lengthening muscles that are compressed. We need compression in certain areas, opposite to expansion, to move into certain places. And I'll go through that in a second. A really easy way of thinking about it is like we need to direct pressure and volume into areas to be able to manage external and internal demands. So it's a bit wordy, but we'll go through it in a second. Okay, so let's say we want to turn our body this way. Okay, so this is where it gets a little bit complicated. So bear with me if I mess up a few words here, but we're going to turn our body this way. In order for us to do that, we're going to have to put compression here. That's going to lead us to have expansion here. To stop us from turning fully, to catch ourselves, we're going to have some compression here and expansion here. So compression, expansion, compression, expansion. So it works in alternating patterns. So if we have, say, right anterior expansion, because we're turning this way, we're going to need left posterior expansion to absorb that rotation, okay? If we have right posterior compression, then we're going to need to have left anterior compression in order to catch that. So we're rotating through it, okay? So push here, so compress here, open here, turning into that to stop us turning all the way around to absorb that rotation of the thorax. We're going to need compression here, expansion here, okay? Now, that might be like seem a little bit crazy or seem a little bit like wordy and stuff. You'll understand that a lot when I go through all the exercises in a minute that we're going to go through. But let's just remember that one more time. So in order to allow for movement, we need alternating compression and expansion. Okay, so this is one of the like cheat sheets, I think, right? It's a little bit difficult, and you might not totally be able to visualize it in your head straight away, but as we go through all the exercises, you should be able to see what I'm talking about. We have lateral compressors of the body. So if we are trying to, I should have a water bottle with me for this, but I'm sure you've heard me talk about before about the water bottle compression expansion. So if something is compressed back to front, squeezing it side to side should open it up a little bit. So think of anyone you see on a foam roller squeezing there, doing a lat smash and reach and stuff like that, or anything like that. Or even if you squeeze a bottle, like a water bottle, it's going to expand front to back. If you turn it to the side and squeeze it again, it's going to expand front to back. So if you laterally compress, you will expand front to back in some aspects, okay? So we can use that in our strength training. We have lots of lateral compressors of our body that will aid us in our anterior to posterior compression. So 3 big ones are our serratus anterior, lats, and obliques. We can go through this. The easiest one, I think, for people to get their head around is the serratus anterior. So we have 3 types. We have lower oblique, which is within that 0 to 60 ranges of shoulder flexion. So almost like a low reach position, which we will get into when we go over our testing in a minute. This pulls back and down and expands posterior rib cage. So pulls back and down, which are these little muscles here. They pull back and down and they expand posteriorly of our rib cage. So this is a lot of people you'll see with low ranges of shoulder flexion and they can't externally rotate at all because they haven't got any space at the posterior part of their rib cage, you'll see a lot of people not be able to get past 0 to 60 in shoulder range of flexion. So these muscles here, these lower oblique serratus anteriors, are really good muscles to start training in order to compress this rib cage here together and open posteriorly. So we're going to compress down here. It's going to open posteriorly for us a little bit, okay? We then have our horizontal obliques, which still, or horizontal serratus anterior, which is still kind of slightly still facing downwards. They squeeze laterally and they open here, they open the expansion at the front. So think of all your rectus abdominis strategy people. This works pretty well here. And then your upper obliques or your upper oblique serratus anterior, which actually are, as you see here, more straight than the horizontal ones. They're great for any of our anterior, because they're going to be all above 90 degrees of shoulder flexion. So think jammer press, stuff like that. Incline dumbbell press, lat pull down variation. They're going to be great for all of our upper anterior expansion and some very upper posterior expansion around the neck, okay? Just because if we're opening anterior position of our chest, it should put our head back into a slightly, not necessarily a chin tuck position, but a slightly better position, which will give us some posterior expansion at the back, okay? The lats are one I use a lot, but I don't think of them as what I'm doing with my lateral compressors, but obviously they are a big lateral compressor, but I think of it more of when I'm doing a lat pull down or a row, I think of it more of the serratus anterior positioning than I do about lats, but they are a big lateral compressor and they push you forward. So as you pull down, they push you forward and they give you like a low anterior expansion. So think about maybe the bottom part of the rectus abdominis strategy people. They can be really good for them. But I don't technically think about the lats too much like that. I tend to think, where am I doing my rows with lower horizontal or of 90 degrees plus? Then probably two of the most underrated muscles in the body, your obliques. So your external obliques, which side bend and push you to the other direction, and your internal obliques, which bring the rib cage back and down. So if we're talking about external obliques and internal obliques, the beautiful thing about them is that they kind of say what they're improving. So if you work on your external obliques, you're going to improve on your external rotation. So think of any kind of cable lift position or any kind of cable or any kind of med ball throw or anything like that. That's all going to help with that. So maybe you do a half kneeling cable lift. It's going to help you massively with your external obliques. Internal obliques, as they bring the rib cage down, think about maybe a cable chop or accepting a catch of a med ball or anything like that. Okay, so let's talk a little bit about the initial movement analysis that I do with people. It usually has a squat, a hip flexion test, and a shoulder flexion test in, and then that will tell me exactly what kind of movement patterns they're missing on a whole. But I'm going to go into the squat and the hip flexion test when I do more of the knee pain stuff. So for today, I'm just going to focus a little bit on the shoulder flexion test that I do. I'm going to go through it in a second, but I just want to run through a few tips and a few things that you'll see a lot within it. Whenever they start to lose space to move into, which is anywhere along here, they're going to start to internally rotate. So the thumb is going to start to turn inwards. That's one thing to look for. If they're somewhere between 0 to 90, so somewhere between here and here the test ends, then they are compressed posteriorly. If they can't supinate their hands fully from the start, then they are compressed posteriorly as well. So think lower traps, think lats, which we talked about here, compressed posteriorly, and they lose external rotation. So if that's something you see at the start, they can't get anywhere close to 90 degrees, or they can't even supinate their hands or turn their hands upwards from the start, they're two things, red flag straight away. You want to make sure that like the kind of compensation patterns that they might put in to try to cheat the test a little bit. So does the shoulder start to roll towards the other one? Do they start to chin tuck? These are signs that they might be shrugging to get more space, right? So if they start to chin tuck straight away, then that's the end of the test. If they start to rotate or roll the other shoulder forward, just be aware of that. Give them one, say, hey, don't roll your shoulder forward, just focus on this side. If they do it again, then whatever range they're at, that's the end of the test. If they're rolling away from you, probably somewhere between the 60 to 120 range is where you'll see that with shoulder flexion, then they lack internal rotation. If they're rolling towards you, then they lack external rotation, okay? And you'll really see that in the 0 to 60 range. Though you should always look at a comparison of sides. If the right side is better, say, it means the posterior expansion is better on the right. So if your right side is better, then your posterior extension is better on the right. So one of the things to think about is whenever we talk, I don't know if I've gone through this before in a group chat and network or anything, but whenever we talk about internal rotation, a lot of that is done because you need to absorb force coming down from gravity. When you lie yourself on the ground, you kind of take some of the internal rotation stuff out of it. So this is more of an external rotation bias test, but it will still give you the information that you need. It's just something to take into consideration. I'm going to run through the actual video of the tests now. I obviously won't play the sound because I'll be talking over it, but just to give you an idea of what it looks like, we're going to have them set up in kind of like that start glute bridge position. I'm going to have them put one of their hands on their rib cage here to try keep it down, to stop it from flaring up, because if that rib cage aggressively flares up, that's the end of the test too. And then I'm going to ask him to reach his hand up by trying to keep his palm facing to the ceiling. If we see this kind of like internal rotation of the thumb here starting to happen, then that's the end of the test. If we see an aggressive flare of the rib cage, that's the end of the test. If we see an elbow bend, that's the end of the test. So there's quite a few things to think about. If we see excessive shrugging of the chin, then that might be the end of the test. If we see a lot of row, he doesn't row at all here, James. James is a very good athlete. So he's probably actually given me, he probably actually could go further than this. He's just trying to demonstrate for the test for me. So then we're going to break it down to really into 3 phases. The first phase being somewhere between 0 and all the way maybe up to here, 85, 90 degrees. That's going to be our low reach position, or of our low angled movement in the gym. Then if he gets, say, where he was here, say he gets to like 90 degrees, bring it all the way up, sorry about this, anywhere around here, so maybe from 85 to like 95 degrees, that's going to be all our horizontal work, rowing, pressing, stuff like that in the gym that we're going to work on. And then obviously if he gets past it, so let's say he goes like, 95, 100, 120, all the way up to there, then we can start looking at our aspects of our higher stuff like our jammer presses and stuff like that. So we'll go through all of that, but this is one of the main things I look at when I'm dealing with someone with shoulder injuries. And to be honest with you, a lot of time they will end up in that 0 to 60 range, because they have some compensations, whether that's a lifelong compensation that they have, or that's a compensation as a reflection of the pain that they're in currently from their injury. It's hard to tell, right? We don't know if we're only testing them for the first time. But what you will find, if it's a lifelong compensation, it will take a little bit longer to heal or to create more movement capacity. If it's a short-term one and it's a reaction to the acute pain that they're in, then you'll get results quicker. And I'll in part 2 of the presentation, I'll go through how I progress people on. Obviously, there's a part of fitness or initial assessments a part of that, but yeah, we'll go through that as well. Okay, so I'm going to take you through a lot of the exercises I use with people who have that initial stage, that less than 90, more than likely 0 to 60 degrees of shoulder flexion. And I'm going to go through how I set them up and how they might look, okay? I think I've put 1, 2, 3, 4, 5, 6, 7 here. I'm going to give you a link to my YouTube channel that has loads. I just picked 7 of the ones that I use most frequently, and I kind of break down why I use them. And then I'll kind of go into what maybe I'm looking at when I'm doing them, and maybe how I might have to adjust as I go along. The first one is really simple. There's a lot of things you can do in that 0 to 60 degrees with a decline bench. So let's start very simply with something like a decline bench press here. Now, this is James obviously doing the movement. One thing I'm always looking for with this is that the knees are above the hips. So you really want to have either on the bench here or on a footstool here. If the bench doesn't have a footstool, I'm going to put them to put their feet on the bench, okay? It's really important to me that we're not arching through that lower back, because we are looking to drive in that range, which, as you can see here, is less than 90. 90 would probably be here on a decline, or maybe here. So less than 90 degrees. So we're looking at all of that posterior expansion that we can get at the back of the rib cage. If we arch our back through that, then maybe we're defeating the purpose a little bit of this. So James obviously is a very good athlete once again. So he's going to do this coming down here. One thing I'm going to really push for them is that make sure that they don't end up rotating their shoulders inwards. So for a lot of them, I might put a block between the barbell and the chest to start. And I'm really, really cueing that chin open as much as possible. So we're not shrugging right in. The chin's nice and open. The chest is nice and open. We are looking at keeping those elbows in line with the rib cage to keep everything nice in a fairly optimal joint biomechanical position. And we're going to be slowing the way down, fastening the way up like any kind of normal bench press. One of the things that I think is really important with this is do not let them overload this too quickly. Start with something like a 4 reps in reserve, get good at movement, find a position for them. If they need to have slightly less of a decline, in order for them to get their knees above their hips. That's fine by me. Another thing that this does is we actually have a lot of gravity working in our favor here, because we'll talk a little bit more about diaphragm and stuff in the part 2 of the shoulder stuff. But one thing is, if our gravity is shooting air to the top of our diaphragm, it's going to help us with posterior and anterior expansion. So by having a nice little decline, it can do that too. So that's like one way you can start looking at low shoulder flexion positions. Now there's tons we can do with lower body as well, but we'll go through that on the knee stuff anyway. So I'm just focusing on upper body here. The next one then is, you'll see me use cables a lot, and they are really a best friend. You can do so much angle wise, especially with rows and lat pull downs with cables. So I'm looking at getting set up at a low reach position here. So if we look at my arm here, it's probably, somewhere between, obviously it's not at 90 degrees, but it's a little bit lower. I want to keep my chest as high as I can here without arching my back, because if I lean into this too much, then I end up just doing like a vertical row, like at 90 degrees, because I'm leaning forward. So I want to try as much as possible, still get a low angle on this. Rows are definitely harder for long angle than low angle stuff than presses. But one thing we are doing here is, because we're pushing away with this hand, we're locking this side of the shoulder in, which means that we're going to get all this posterior expansion at this end range here, and we're going to get anterior expansion at the front here. So when they're at this position here, we're going to get nice anterior expansion. And when we're at the very end, look how open that is at the back. We're going to get some posterior expansion. The whole time we're going to be driving a lot of anterior expansion through this position here, because as you remember, when we're rowing, if you remember back to our thoracic rotation, if we're turning one way, then if we're turning, say, with our right arms rowing as we come down, this is going to be compressing and this is going to be expanding. So if someone's lacking a lot of posterior expansion on one side, you can row with the other and still be working really well on opening up the posterior side of the side that's not rowing. I like something called a constraint-based approach, where most things are locked in, so knees locked in, arms locked in, because it really doesn't leave that much room to mess up the position. So when we're looking at pushing towards fatigue a little bit more, to maybe closer to a 2 reps in reserve, we can do that with the relative idea that we should be okay. We should be okay with our ability to like not move too much. We're not going to compensate massively and have fatigue, side crunching, stuff like that. Okay, then another way of doing it is, this is a kind of what I call a better bench row. You've got to be careful with this one. You kind of need to keep your chest pretty high as much as possible. Once again, we're getting all the same kind of benefits we are out of this one, just at a slightly different angle, but we still want to make sure that we're reaching low. So you can see here, I'm getting a big stretch at the end, pulling up, and I'm still kind of low, reaching just below 90 degrees of shoulder flexion, so probably around 70, 80, which is still fine for that low reach position. Obviously, I would like it a little bit lower, but here's just another little option. Then we have a lot of these pressing movements that are really important. So something like a staggered stance cable press with a reach. You'll see me use a reach everywhere because it gets the other shoulder out of the way. So we really want to focus on both things, right? We want to focus on both shoulders, but if we can lock one into place, then we can really influence or put a real incentive on the shoulder that we're moving as well. So just like with the low bench row here, we're going to see a lot of similar things with the stagger stance press of reach. First of all, slight little stagger stance, slight little forward, slight little lean forward. We have both our hands at a slight, I would actually like if James was a slightly lower reach here, but it's not the end of the world. Once again, as he's eccentrically lengthening it back, he's getting all of those eccentric lengthening of the chest muscles that we talk about for anterior expansion of the chest, especially the anterior chest wall expansion. As he pushes down, he's going to get compression here, and he's going to get lots of expansion here. But because we have like a locked in pelvis rib cage relationship here, just like with here, we're going to move effectively around that. If we weren't very well locked in and we weren't able to absorb force through our lower body, and our pelvis and rib cage weren't locked in properly or stacked properly, say, then we might see some more compensations. So this is one that you probably don't take as close to fatigue because it's slightly more vulnerable for compensations. But if you do it well, so right now he's got anterior, we'll say probably a little bit of anterior expansion here, but at that end position, he's got tons of posterior expansion. So a bit of anterior expansion here to stop him from fully rotating, pushes through, and he gets lots of posterior expansion on that side too. Now, once again, I would probably prefer if he was low reaching a little bit, but these are all angles that can be done at below 90 degrees, okay? Then we have something like maybe we want to not be as locked in when it comes to our pressing movement, so we can do something very similar to our barbell press, but we have an alternating press. And one of the things that I love with alternating presses is it allows you to challenge them a little bit with their end position. So let's say he presses down here. I'm going to tell him to press past this hand with his hand that he's moving. And we'll see it again here. So he's going to press down, and I'm going to say press past your hand here, which is the instruction I'm giving him as he's doing this film. So we can start looking to get a little bit more out of each movement. Okay, so it's a nice little way of encouraging them to get, rather than lazily pushing to the top, I want you to press past this hand here, come back down, press past this hand here. And you can also do that with any of your stagger stance stuff here. You can ask him to try press past this hand each time. So we're getting a little bit more range of motion throughout. Then you can do something like this. Obviously, neutral grip handles are really important for this. I don't love under grip or over grip, to be honest with you. I think they lock in the shoulders too much into a position that most people are kind of going to be compensating from the very start. So if you do have a neutral pair of neutral grip handles, that would be great. I've seen people do it with D handles from cables and lock it in. That's also a possibility. So obviously this is probably like, you know, at that bottom position, probably just less than 90 degrees. And the reason is I wanted to make this a little bit or more of a low and reach, but we have a mirror here that I'm about to hit my head on. But if I was to bring myself feet in and my angle a little bit more, then I can get a lot of nice low reach stuff in here while absorbing our position of absorbing body weight force too, which is obviously important. So at that top position, pull myself up, we can probably get a little bit of anterior expansion. Something I would like to do with a lot of these is add a groin squeeze into all of them. So I'd probably add a foam roller into each one of people's groins so they can start driving internal rotation. That tends to allow them to, with the nutation of the hips, it tends to allow them to have a slightly better rib cage to pelvis position if they are doing some kind of groin squeeze, which you'll see a lot of those in a minute anyway, so I won't go too much into it. But here's just another nice little row variation that you can do at less than 90 degrees. Then we have like the slightly more complex that might get you laughed at on social media, something like this. So I am locking everything into place here. So if someone's really like restricted, then I'm probably going to start with something like this. We've got that crossbody here, so the elbow to knee, everything's opened up here. I want them to put pressure. They're not moving there, and then I'm going to get them to press probably a little bit less than I'm pressing here. Basically probably around to there, press through and reaching across. So getting everything's locked in, very hard for them to move, and they can start like this, really driving posterior expansion, driving anterior compression here. So posterior expansion, anterior compression, anterior expansion here at the end position, posterior expansion. So we're looking at, you know, if we're driving one, the opposite has to be true too. So if we're driving posterior expansion at the end, then we are also driving anterior compression. So we can always be working on something, and then we might use breathing, like I said earlier, to bias inhalation or bias exhalation based on whether we want more compression or expansion in certain areas. So there's something we can do with that too. That might be a whole presentation on its own, but if someone has any questions on that, by all means, I can work on that too and put that in part 2 of the presentation. Okay, so now we've moved on from less than 90 degrees of shoulder flexion. Let's look a little bit more at actual just straight 90 degrees of shoulder flexion, stuff that you're probably more familiar with when it comes to rows and pressing movements, and all the kind of little variations that I like to do in order to make them more effective. So let's start with something like a seated cable chest press. I'm sure a lot of you have seen this before. You can make this a really great exercise for shoulder pain if you do a few little adjustments. So the first thing, as always, we're going to get our rib cage and pelvis stacked. So we're going to look once again at having our knees above our hips where we can. Our feet locked in here is great. If we don't have something that looks like this, sometimes I'll put my feet on the bench, or I'll put a little box or something to make sure that I can have my feet raised. Okay. From there, little groin squeeze that's going to add into the nutation of the pelvis and improve our internal rotation around here, which should let our rib cage and pelvis relationship be a bit more stacked. Then we're going to, and we'll get into this in the next presentation when we talk about locking in position for anterior chest wall expansion versus posterior expansion. So that is coming, but just a little bit more on it here. Because we're locked into the bench here, we can't go anywhere. So if we keep our rib cage nice and like in a good position, not completely crunched down, but not letting it raise and flare up, then we should get a lot of anterior chest wall expansion at the end position. Once again, you can work this completely to the ability of someone's shoulder range. But if you are at 90 degrees of shoulder flexion now, then you should have slightly better shoulder range than someone who's less than 90 degrees. So from here, you can have it come back as far as you want. So maybe it's only to here and pressing through. You can also do this single armed as well. I like doing it both double and single arm. But yeah, like I said, you can add in a groin squeeze. You can get the feet up and all this stuff to lock in the pelvis, but really making sure you go nice and slow on the eccentric. Once again, looking at all of those eccentric lengthening of the muscles of the chest, so the pec major, pec minor, and how that might affect internal rotation if you remember back from the distance between our shoulder and our sternum. So loads we can do there. Then we have something that's like maybe a little bit hard to mess up. Like this is one of the perfect exercises that I think personally for getting someone back to horizontal pressing at 90 degrees. Feet are locked in. Once again, I can put a groin squeeze in here if I want to. I don't have it right now, but you can, of course. Feet locked in, 90 degrees, pelvis, perfect, can't move. From there, then, they're coming down at that bottom position, just like when the bench is behind them with the floor behind them. They can't really, unless you're really flaring up your rib cage, so you want to watch for that, there's nowhere they can really go. So at that bottom position, they're getting a lot of anterior chest wall expansion, and they're staying in a fairly safe range for them. It's hard for people to get into a poor range with the floor behind them on a floor press. So one of the overall the best exercises I think for getting someone back to horizontal pressing, and you can obviously do this with both, or you can alternate and reach past like we talked about previously. Then something like this once again works really well. I love a seated row. I don't necessarily love a double arm seated row. I think there's probably too much locked in there, but a single arm seated row works really, really well for horizontal loading at 90 degrees of shoulder flexion. So once again, we can do all the things that we talked about. Now, I don't have a groin squeeze in here because I'm actually just using the bench. But if you were sitting in a traditional seated row machine, then maybe you want to add a groin squeeze in. But once again, I'm using the bench as my groin squeeze. I am once again letting my arm go past at that 90 degrees. Now, this is probably slightly lower than 90 degrees, so maybe you can make it a touch higher. But once again, you have all the posterior expansion here, all the anterior compression, turning that round. Once again, we have the opposite on the other side. So when we're at this position here, we're getting lots of anterior expansion. And because we're locked in here, our rib cage and pelvis should be in a good position. They shouldn't be flaring up. That's something, obviously, this is a little bit more of a variation one where when you get closer to fatigue, you might see some more compensations, so just be aware of that. Once again, a really, really nice exercise to ease people back into. I'm probably going quite heavy here as well, so maybe it doesn't need to go that heavy, maybe 3 to 4 reps in reserve. This feels like it's a little bit heavier based on my grimacing on my face. Once again, I'm asking that person to reach far away as possible, okay? There is another variation of this. I hope I have it in here somewhere. If not, I'll add it at the end, that I really like for people starting. This is how I like everyone doing most of the time. This is how I like them doing their horizontal rows or single arm rows. Forearm down, locked in position here, can't go anywhere. Leg out to the side, sitting into this hip a little bit, going nowhere. So all of this is really locked in, and they can get nice and low down. Loads of posterior expansion here, loads of posterior expansion here at that top point. Good anterior expansion. Once again, this is pretty heavy. I'd probably go a little bit lighter for someone else. But yeah, once again, I really like this. Lock in that constraints-based approach as much as possible. This is maybe a slightly more, like if you don't have a bench or something like that and you want to get this in, you can easily do a single arm bent over row. Nice little groin squeeze here, get that posterior. This is one that's obviously slightly more difficult to not arch your back in. So by adding a groin squeeze, you can see here that I've got a good nutation of the hips. I'm not actually really arching at all, which is good, which means that when I go down, I should be getting lots of posterior expansion here. And then when I come up, if I keep it in line or just past in line, say around here, then I should be getting lots of anterior expansion here. Once again, you can probably move this to, depending on your ability to hinge, obviously it's a little bit more difficult. Sometimes you can put them against a wall, so they're sitting against a wall and doing it. There's a lot that you can do here, okay? I'm not a massive fan of a traditional bench press for most people with shoulder injuries at the start. Once we get past, like the declines are slightly different because with low range, it's kind of hard to mess up. But once we get past to more 90 degrees and maybe incline, I kind of like to use either a Cadillac bar or I like to use dumbbells. But once again, we are doing all the things that are going to keep the main part of our body in place. So our pelvis, rib cage, and groin squeeze are all going to be influencing it. Okay, so Because we're locked in here, our pelvis is locked in, we're not arching for our back. As we get to the top, we're reaching really far away. We're going to get some posterior expansion here. Once again, as we are locked in behind us at that bottom position, we are going to get some anterior chest wall expansion as long as our rib cage isn't too flared up. Okay. So once again, they all work pretty well. As you'll see, they're starting to see a similar trend that if we lock everything in and put us to ranges of motion that are available to us, we'll get good results. Then something like this can be slightly more difficult too, because slightly more challenging, maybe get a bit more of the internal rotation working because we're now fighting against gravity. I really like something like this, getting into position, start to introduce a little bit of range of motion and rotation into it. And we'll go through all the planes of motion in the next presentation. I know you're probably thinking, how much rotation, how much side bending and stuff like that. We'll go through all of that, so don't worry. I'm just giving you a list of exercises to start today. So once again, at 90 degrees of shoulder flexion, nice controlled. You can obviously put a groin squeeze in here, but I do like if you can really engage that pelvis and have a nice neutral pelvis, then I really like this as a tester of extending in a pressing motion without having to, slightly less constraints based approach, I guess, but it's like a one that you can challenge yourself with. Okay. Then this is like, I think every single shoulder and upper body tension program should have a really long reach row in it, whether that be at 90 degrees, at less than 90 degrees or above 90 degrees. And then like really reaching out like this. So you can see how much this, for the scapation of the shoulder plates alone, they'll love this. Okay. So putting in, reaching, you get tons of anterior extension. And I've locked myself in here by reaching across, grabbing my leg, kind of similar to the one that we had the crossbody press when I was on the floor earlier. I'm really locked in here, so I'm not going to be able to move too much. So I can really just let my shoulder go and know that I'm not really compensating too much because I can't actually move too much out of that position. But look at how much open posterior expansion we get here. So if someone's really struggling with external rotation, this might be a really good one for them. Then one more thing that I don't know if I put it in, but I want to show you is very simply a standing row and reach. Once again, a really easy one to implement for most people to start with. You can 100% add a groin squeeze in here, but a slight squat, get into a good position where your pelvis is nice and locked in as here. You can then obviously reach it away, get that line here, loads of anterior expansion, reaching away from you, reaching past that hand, getting loads of posterior expansion. And remember, because we're always alternating whenever we're working one, the other is also being worked, okay? So I really like these movements for basic, easy starting movements for 90 degrees of shoulder flexion. We're going to go through now our above 90 degrees of shoulder flexion, and then that will kind of be the end of part one. So we'll get into what part two looks like, but don't worry, we're going to go break down sets, reps, and all that stuff in part two, okay? Finally, we're going to go through the last phase of shoulder flexion, which is above 90 degrees. So this is probably where you'll see a lot of the late stage rehab that you have with your patients, clients, etc. Sometimes they will have the ability to start here, which is great, and it probably will be a shorter term rehab. Maybe not necessarily totally for pain wise, but definitely for movement capacity. One of the things with this is that you'll see that I use cables a lot, because by using cables, you can adjust the actual range of shoulder flexion. So you can start just above 90 and get all the way up as high as you want. So let's go through some of the exercises. You'll see like the short seated position on benches is basically when I have my knees up kind of above my hips, essentially similar to that. But when you're on the floor, you'll see it look a lot more like what you see here in the video of James. This is a real nice alternating row position. Now, very hard to mess this up if you're locked in properly. So a slight cushion just so you're not on the uncomfortable ground. Bring your knees right as close to your chest as possible. It might be, James has obviously got good mobility, so he might be able to bring his knees close to his chest than some people will. But each time, because all of that's locked in, we're not really worried about arching of the lower back or anything like that. So we can really focus on getting as much long range opening of the posterior part of the rib cage. And we can see that each time as he pulls up, he gets a real big stretch on this. So it's a lovely one for our shoulder blades. And obviously we are getting kind of a constant stretch on it because one hand is always under load. But basically they're both under load, but one, it's not like they get to relax at each time. So that's a good one too. So this is a nice one to maybe start with if you have someone who has good mobility, especially in the lower part. You can obviously break it down into a couple more ways. So this is a slightly longer seated one. You can grab this here, so you are getting the other shoulder blade out of the way. So just bring it down slightly. This obviously is quite a high range of shoulder flexion, but once again, we're locked in here, feet against here, rib cage locked in, pelvis locked in, arm locked in. So very hard for us to mess this up. You could probably start it with a cable position around here and then work your way up. Another variation of this is a short-seated one. Once again, similar to this one here, but with one arm, and you can grab the other arm to lock yourself complete, or grab your arm around your leg to lock yourself completely in place. Really hard to mess this one up too, so a nice little one to start by bringing people into high ranges of shoulder flexion. I don't do the greatest job with my head here, actually. I would hope that I could just keep a slightly more nice neutral chin as I'm doing this. But that's something that you probably want to focus on a little bit more with your clients, keeping that anterior part of your chest open. I probably was a bit tired I was probably filming a bunch. You can see I'm kind of crunching here a little bit, which isn't great. So maybe I bring my feet out a little bit. This is probably on a filming day where I film a bunch of stuff and then I'm just a little fatigued at the end of it. But it's a good thing to see. This is probably not what you want to see. So once again, it has everything you need locked in. I could maybe be a bit more open with my chest, so maybe I need to bring my legs out, or maybe just take a little bit of rest and bring the weight down a little bit. I'm grabbing my leg. Everything at the end should be nice and open here at the back, especially on the posterior side of the left here, because if my arm's reaching away, it can't go anywhere. So once again, just another nice little variation. This one we'll talk a bit more about in the next part 2 of the presentation. Anterior opening and posterior opening, like I spoke about a little bit, and how we can really do those with isometrics as well and breathing exercises. But this is just one I wanted to drop in here. This is one of the greatest ones for eccentrically lengthening the pecs and getting good breathing, getting good breathing patterns back for someone who struggles with anterior opening of the chest wall. So feet locked in, pelvis locked in. We have light enough weights. We're opened up here on the chest because we're locked in against the bench. Can't go anywhere as long as our ribcage isn't excessively flared up. So it's nice and neutral like this one here. I am doing 30 seconds or 5-second breath cycles. So I'm doing 2.5 in through my nose gently, 2.5 out from my mouth. And I'm just trying to calm everything down in my central nervous system in this position here. You'll do this with clients and they will feel great the first couple of times. It loses effect a little bit after a while, but it's one that I put into most people's warm-ups, especially if there's someone who's lacking internal rotation of the shoulder. Like we said, more space between the sternum and the shoulder, better internal rotation, okay? This obviously is a very simple one that you'll see a lot, an incline alternating dumbbell press. Once again, I'm not totally against doing double arm press stuff at the start. I don't usually do it though. I do single arm, and once again, I'm really emphasizing on that. This hand should reach past this hand, so we're getting a little bit of extra range of motion at the back. As you'll see, once again, the same kind of things will apply. I don't want a real excessive arch in the back. I don't want a high flare in the rib cage. I want that to be stacked, and I want to be moving around it at the start. Well, as I said, next week we'll get into sagittal, frontal, and transverse planes of motion and where to add them in. But right now we're really focused on, can we lock that rib cage in? Can we stack that pelvis and rib cage? And can we get good movement around that? Okay. So once again, everything's locked in, pressing pass. And once again, we're trying to keep that elbow in line with the rib cage and having them work to the ranges that they have available to them and slightly trying to increase it. Okay, then this one's in again. Okay, then towards the end now, like there is loads of variations of lat pull downs, loads of variations of pressing, kneeling jammer presses and stuff like that, which I think was here. Yes. Obviously, this is kind of an in-between one. So locking everything in here in a half kneeling position is great. Don't overload these too heavy. I'm not a massive fan of people like really slowly pushing it up and side crunching and arching. Keep them nice and light. You can do loads of things like focus on the eccentric, focus on the elbow position, make sure everything stays nice and locked. You can obviously add a reach in here if you want, or a crossbody grab at a rib cage like this. They both work. That's obviously a nice little in between before we go directly to overhead pressing. There's two kind of like clearance tests, I call them, I guess, towards the end of the shoulder flexion. So one of them would be, can they comfortably do a half kneeling press with reach? Can they do it fast? Can they do it slow? Can they do it without any pain? And if they can, I'll progress that over for maybe 3 to 4 weeks, loading it up. And then I'll move them on to what I think is their clearance test, which is a feet locked, long seated Z press on the floor. Can they do this pain-free? Can they progress this for a couple of weeks without seeing any big regressions and compensations? And if they can, I'm going to be pretty comfortable that they've completed most of their movement capacity work for their shoulder, especially in shoulder flexion considerations anyway. Okay, so there's a lot to that. I think in total that's going to be about 40 minutes maybe, so it's quite a lot there. Think of any questions you want me to address in relation to this in part 2. But part 2, we're going to go through opening up anterior and posterior. We're going to go through the role of sagittal, frontal, and planes. We're going to go through the role of intensity. We're going to go through when to move them on from one to the other. We're going to go through what way I plan my sessions. We're going to go through dynamic reinforcement work, so yielding work with the upper body. We're going to go through capacity work, so when to move them closer to fatigue, and then I'll give you a couple sample sessions. So there's quite a lot coming in the second part, but make sure you watch this first and have any questions I can add to the second part pretty easily. So yeah, I hope everyone has a great time watching it. If you have any specific questions, just throw them in a group chat.